stress me out. Okay, so in this chapter, we're going to specifically talk about skin analysis. So this is a variation of the skin analysis form. You may take it and look at it and pass it around. So I'm going to read directly from the book for a second and talk just specifically about skin analysis and what it is. So learning about individual skin types and conditions is one of the most interesting aspects of skincare. It is never boring because each face is unique. Client skin analysis is a vital part of an esthetician's skills, since recommending the appropriate skincare products and regimen must be individualized to suit each person. Before performing any services or selecting products, an individual skin type and conditions must be analyzed correctly. So in the protocol book that you got, I don't think you two ladies got it yet, but in the protocol book there are multiple facials. So there's a 30-minute facial, a 60-minute facial, and then a 60-minute advanced facial, chemical peels, microderm. In any facial that you do, you're going to do your first cleanse, analyze the skin, and then your second cleanse throughout the rest of the facial. You cannot do any of the facial after the skin analysis if you don't do the skin analysis, because you won't know what to use. Does that make sense? Products and skincare are customized to treat certain skin types and conditions. That's why there's so many different cleansers, exfoliators, masks that you can choose from. Simply put, a skin analysis determines what fun stuff you get to play with and what you're actually doing for the client in that particular treatment. So let's first go over skin types. You're going to want to write these down. These are important to know. The first one is going to be dry. The characteristics of a dry skin type is going to be alopecia. They're going to have small follicles. They're going to be more sensitive. Their skin is going to feel rough. The goal for this type of skin is to stimulate oil production and protect the surface of the skin. So who in here knows what alopecia means or stands for? No worries. So the definition of alopecia skin is skin that lacks oil. Dry skin lacks oil. It's rough in texture. It has small follicles, also known as pores, and it's more sensitive than a normal oily or combination skin type. Okay? The skin type is what we're born with. It is genetically decided. It does not change over the course of age. It doesn't change over the course of a season. It is not impacted by conditions. Your skin type is your skin type is your skin type. What affects it is internal and external factors. That's going to be important to remember, because everyone has a skin type. What's happening to that skin type is what's considered a condition. Okay, so right now we're talking about each one of the skin types. Skin type is genetic, and oftentimes, more often than not, we're going to determine it by characteristics that include texture, oil production, size of the follicle. When in doubt, when you're doing the skin analysis, if you cannot tell or one area is different from the other, note it on your skin analysis form and then check it over the course of the next few treatments. Typically, their actual skin type will be revealed once the conditions are a little bit more under control. So the next skin type is going to be normal. It's the average skin type. Most people will have normal skin. The size of the follicles in normal skin are going to be normal. They're not going to be very small. They're not going to be enlarged. Has anyone ever seen the follicles on their nose? That's considered medium to large. Normal follicles are anything smaller than that. Small follicles are follicles you have to work really hard to see. Okay? Once we get under the magnifying lamp, it'll make more sense once you can see it.
I'm just uncomfortable. Let me just.
You're so funny.
Sorry.
But you're like,
I was trying not to interrupt you, but I can't. I just can't with this. Okay, look, back up against the wall. I'm not gonna bother you again. Carry on with your lecture.
everyone, please know that that's Veronica.
Sorry.
Not the good Veronica.
Wicked OCD, and there's certain
The
conditions
original one.
I can't function under.
Back there really struggling. Okay, the next skin type, remember skin type is genetically predisposed. You're genetically predisposed to your skin type, okay? So combination is gonna be the third. We have dry, normal, and now combination. Combination skin is going to be oilier in the T-zone. See my T? T-zone. And the outer face may be dry or normal. Combination skin means that their oil and water balance needs to be achieved. So something is out of whack to where their oil and water is out of whack. Fun fact, the skin cannot tell the difference between oil and water. So remember when I said a dry skin type lacks oil? If a client has medium-sized follicles or normal size, they're considered normal. If they tell you, I'm consistently dry, my skin's so thirsty, is their skin type normal or dry?
Dry.
Their skin type is normal. The follicle didn't change, they're dehydrated. The skin cannot tell the difference between lacking oil and lacking water. If their pores are normal, they're normal. If their pores are small, they're dry. Because dry, alipedic, lacks oil. Dehydrated lacks water. But because our bodies don't know the difference, perpetually dehydrated here, my skin will be dry at times. But in reality, I have normal to oily skin. But because I don't maintain the water that I need to, it'll feel dry.
By water, you mean internally?
Yes, drinking water. I'm not drinking enough water to make sure that I'm hydrated. Because that's something you have to maintain. We're all born hydrated, but if you allow yourself to get dehydrated, then the only way to fix it is by rehydrating. There's no moisturizer in the world that's going to fix dehydration. So as the esthetician, if you wrongfully diagnose their skin type, and I'm not going to say diagnose, I'm sorry, that's a naughty word. Don't say diagnose. Never say diagnose. We're not doctors. We don't diagnose. If I identify their skin type as dry, but it's really normal, and they're just dehydrated, I'm selling them a bunch of products that will not work. Guess who they're not going to come back to? Because they're not going to see the results. They're going to put on all this oil because we think they're dry, when in reality, telling them to drink more water and giving them a normal moisturizer would be a much better solution. See? Everybody with me so far? Skin type is the foundation of what you're going to do moving forward. You need to first identify that skin type. You cannot make any more decisions without knowing that. So in skin analysis, one of the first things you need to determine is skin type. The next skin type is going to be oily. Oily skin is going to have excess sebum in the follicle, meaning oil. Sebum is oil. They're going to have larger follicles, which makes sense because the more oil your body naturally produces, the larger the follicle has to be for it to come out of the skin. Their skin is going to be thicker, sallow, and oily skin requires more cleansing and exfoliation. They can get deeper cleansers, typically cleansers that include some type of vitamin or some type of acid, and they can exfoliate 3 to 4 times a week as opposed to a dry that needs to exfoliate 1 to 2, as opposed to a normal that should be exfoliated about 3 times.
What is sallow?
It's a way to describe the skin. Let me get the actual definition for you. It's probably not in here. No, it's okay. You'd rather know.
And we were all wondering because nobody answered.
So we all wanted to know, but we didn't want to
We didn't want to
ask.
ask. We were just riding on your curtail.
So the actual definition of sallow skin is going to be a person's face or complexion that has an unhealthy yellow or pale brown color. So it lacks luster, it lacks shine, it lacks vibrancy. Sallow. They look dull. They look boring. You know, washed out is a good one. Have you ever seen somebody that had the flu? They were real cute one day, and then you come in and you're like, what's wrong with you? Sallow. It's the best way to describe it. They lack luster in their skin.
I'm sorry.
No worries.
These are going to be available to us?
Yes, those will be in the download folder probably within the hour, and then there'll be excess copies here. I'm going to get one made custom for our school, so this is not the one the clients will use, but it's just another version. The next skin type, I don't necessarily agree with, and this is why. Notice it says a skin type and condition. Sensitive. Fragile, thin, red, easily irritated. The goal with this skin type, air quotes because it's not a traditional type, is to soothe, calm, and protect. More than likely, no one's born with sensitive or aging skin, right? These are things that have been adapted to be skin types, but a baby is not born with aging skin. Environmental factors cause aging to happen. Same with sensitivity. That's why it says a skin type and condition. Rosacea, you'll learn a lot about. Excess exfoliation, sunburns, consistent sunburns. Those things create sensitivity in the skin. There's not a baby in the world that I've ever heard of that was born with sensitive skin. And because we know that skin type is genetic, sensitive to me is more of a condition. You typically get sensitive because something happened, or there's a condition creating the
It could
sensitivity.
easily be an allergy.
It could. So how can you say something, they're born with it and it's an allergy causing it? Because if you avoid your allergy,
Yeah, the stimulant, then you won't have the
you avoid the sensitivity. So that's why I personally do not consider it a skin type. Welcome to Milady. Have a question?
I agree because like I have, based on the amount of stress I'm undergoing,
Mhm.
I'll have sensitive skin and I'll react to everything. But if I'm in a like peaceful state of mind, my skin doesn't.
It's not a problem. And notice that all of the other ones indicate a pore size. Sensitive doesn't indicate
Just
a pore
reaction.
size because it's a reaction. Absolutely. I 100% agree. The book says it's a skin type and condition, so Milady trumps me. Sorry. But if I was explaining it to my client, I would not explain that as a skin type. I think people like to categorize things to make them feel better. Oh, no, I'm just sensitive. Oh, I have to use this $100 moisturizer because I'm sensitive. Honey, it's not the moisturizer, it's the fragrance. Red dye number 4 will mess me up.
If I eat gluten, I'm all eczema'd out.
Hello? Rash?
Like all of a sudden I have eczema. No, I had bread.
Absolutely. I didn't have eczema, I had carbs, thank you. But
No, I'm
that's a
fat
very
and dry.
Exactly. And angry. That's a very good way to put it. It's not, that's a people thing. Oh, I need this moisturizer because it says sensitive. Sensitive is not a skin type. It's something presently happening in your body that you need to get under control. Skincare is, if you really think about it, as an esthetician, this is one of the best jobs because people need to come to you for life. We all have skin. There's always somebody that has an issue with their skin that you need to maintain. And if you fix it for them, they'll stay with you forever. Just like lashes, I don't want everyone in my lashes. I mean, not me, 'cause I'm not particular. But you've heard the people, oh, no one else can do my brows. No one else can do my nails. Skin is the exact same way. And because our skin turns over, we'll talk about it, but as our skin is constantly changing and adapting, they constantly need you. Yes, ma'am.
So what's the difference between us and like a dermatologist or
A
dermatologist?
degree. Let
And
me tell
they'll
you,
let you to prescribe.
Like visit to a doctor? Are they?
they're still a doctor. Yeah. A dermatologist, truly know very little about skin care.
They only know about skin conditions.
They
Okay.
treat conditions.
And in reality, they just know how to prescribe steroids.
Absolutely.
That's really all they know.
And it
In
honestly is
in my
true.
humble opinion.
So there's dermatologists, like, you'll see stuff on products like dermatologists recommend it. Dermatologists don't do facials. They don't manipulate the skin. They treat issues like acne. And they treat issues with the most extreme form of medicine possible. Did you know that the Accutane can cause birth defects? Can cause a woman not to be able to have a baby. It could change your cycle. It could sensitize your skin. But they prescribe it because it's an easy fix, it's expensive, and they make more money. As opposed to saying, maybe you're getting acne because of the gluten or the dairy. That's our job. We can say, let's look at your diet, let's look at your lifestyle, let's look at your face wash, let's look at your skin type,
And how much water you
and
take in.
and how much water you're taking in versus how much water you're, getting out. How much exercise are you doing? We can make those calls. A dermatologist is going to say you have acne.
Here's some antibiotics.
Good luck. And it's going to go away because it completely destroys the skin.
Okay.
But the second you're off of it,
Comes back.
Yeah.
same problem.
Because I do see some estheticians that go work for dermatologists.
Because they get to do more fun stuff.
Yeah, they get to do the T peels and all the others.
They get to do peels that are done in hospitals. Peels that you take medicine for. Like,
Is that why they have the term the medical esthetician?
yeah,
Like, to
that's
go
not
to
a real
surgery?
thing.
Oh, it's
No,
not?
it's really
It's
not.
a sales
Oh.
sales pitch. Yeah, I know. When I found out I was Max, I was like,
Yeah, I didn't know that. I just.
it's a $10,000 made up
I
name.
was today years old when I
Yeah.
found that
Yeah.
out.
I was today
I'm
years
today
old.
years
And you know how, and like honestly, this is how I know. My mom does hair. She's been doing hair for 50 years. Her first cousin and closest, like favorite cousin, is a doctor locally. So about 10 years ago, my mother, who's never done a facial, but her cosmetology license allows her to,
Mhm.
okay, goes into business with her cousin, who is a doctor, a very well-established doctor here in San Antonio, and they open up this whole skincare area of her practice. And literally, legit, my mom spent a weekend and like a total of 6 days in Las Vegas getting her certification to become a medical esthetician. And I watched like her coursework and all her
Mhm.
paperwork, and I'm like, now you're a medical esthetician,
Right.
but all you know is hair.
Right.
She's like, well, no, I mean, I went and really
For 6 days.
for TDLR, I had a huge argument with one of my girls in my salon yesterday because she's a hairdresser that wants to move on to do like, the hyaluronic and
Yeah.
the needle, the micro needling and all that.
Mhm.
We had a long discussion about the difference between the epidermis and the dermis.
Right.
And I'm like, that's why you do hair, girl. I mean, like, I know that they allow you to do faces, but they spend, 10 hours out of
On
1,500 on skincare?
That's why I'm like repeating skin type. It's genetic. You have to know. That's what separates you from a cosmetologist. Yes, they can do your job.
They're allowed.
Should they?
Mm.
Because they don't know the difference between a skin type and a skin condition. And it matters. It
They don't
truly,
even know the
truly
difference
matters.
between the epidermis and the dermis.
Poor babies. And she wants to stab someone.
Well,
Oh,
I always
yeah.
wondered when I see like esthetician and with the A, and I'm like,
That's-
I knew it said medical
What is
esthetician,
the-
but I'm
anyways,
like, why
it's
do
the
they
same
like separate?
Dollar bills, y'all.
So it's
That's
just
all
for
about
later?
money.
No, it's the same. They might take a few extra courses, but they're not courses that we can't take.
Absolutely. There's nothing that you can't go do.
Yeah.
It
they
just
just
costs
take a
you
few
money.
extra
So we don't have to like
courses.
have an RN or like a
No,
medical
no.
degree?
No, the only
Because
one
you
of
work
us,
under a
That's
doctor.
what I thought.
the only one of us that would qualify as a medical esthetician will be Sanja. She becomes an esthetician.
Absolutely. Sandra would be
Because
a
she's a
medical
nurse.
esthetician. She is a licensed nurse in the state of Texas, but she still can't use it unless she works under a doctor.
True.
There's a limit to our ability. We can only apply an acid that goes so deep into the dermis. We can only apply this type of laser after taking a laser certification. We can only do X, Y, and Z unless we work under a physician. Now, if Sandra was to go and get her master's and be a nurse practitioner, then she can open up her own medical spa and
Her
be
med spa.
a medical esthetician. But I can go work for a doctor and put
Put an A
medical
in front of
esthetician
your-
on my name and, oh yeah, I'm better than you now.
Okay.
But you're not. all
It's
marketing.
It's all without your doctor.
Dang,
Well,
Google
who are
Eyes.
you without your doctor?
Google Eyes.
Google Eyes.
This is a vain industry, ladies. Learn to sift through the BS real fast. Otherwise, you're going to be wasting money. So we're going to move on to skin classification systems. We have the Fitzpatrick scale. We have the Glygal scale. And we have Rubin's classification for photo damage. I have never in my life heard of Rubin's classification for photo damage. That is very, very, very new. I don't know where that came from. I don't even think that's in the book. Oh, wow, it is. Oh, that's so
Adding a
cool.
whole new classification.
We'll read about that together because I've honestly, genuinely, I've never worked with that type of a classification before. So we'll definitely be learning that together. First is the Fitzpatrick scale. It's used to measure the skin type's ability to tolerate sun exposure. In layman's terms, the lighter or whiter you are, the less sun damage that you can take. The darker and the more melanin you have, the more sun damage you can take. Me and a Fitzpatrick 2 can stand outside. I'm going to burn slower than she's going to burn. I have more protection.
Gonna age slower.
I'm also going
Have
to
a
age
little bit of
slower.
resentment towards you in that area.
I'm pretty sure. I don't blame you. I'd be mad too. I'm going to look 20 forever. It's fine.
You're gonna get ID'd forever.
And
I'm not.
a lower Fitzpatrick would not. So that's something we'll talk about more in detail. But in your book, in Cengage, there's a chart that you can study. I may even get this printed and hung up in the spa rooms so we can have. Fitzpatrick, because it only determines sun exposure risk, it's really not widely used. The Fitzpatrick comes into play when we talk about sun exposure and chemical peels.
I use it a lot.
You use Fitzpatrick. Oh, because you use lasers.
Well, because I use electricity and I do anti-aging.
Gotcha.
So I'm having to repair, and I'm like, well, you're 60 and you're a 1 on the Fitzpatric scale.
So
you're
I'm gonna
look-
burn you really, really quick.
You're gonna look a lot different than somebody who's a 3 on the Fitzpatrick scale.
The results aren't gonna be the same.
Right.
That's
Can't look like J-Lo if you're a 1.
That's an advanced treatment. So when we talk about chemical peels, maybe even microderm, we'll talk more about the Fitzpatrick. Don't ignore it for now, but just know that we'll talk about it in more detail in the advanced topics. The next one is going to be the Glygal scale, which it evaluates photo damage based on wrinkling categorized by age. I feel like what they're doing is they're replacing Glygal with Rubin's classification. So the Glygal scale evaluates photo damage, sun damage, based on wrinkling characterized by age. Type 1 is minimal to no wrinkles between the age of 20 to 30 or younger. So I'm a Glygal 1. I have no wrinkles, even in motion. Nothing's wrinkling. Type 2 shows wrinkles only visible when in motion, when making facial expressions. This is early to moderate photo aging. Light keratosis is involved, and this is age 30 to 40. Glygal type 3 shows wrinkles at rest. There would be wrinkles present if I had a Glygal 3. And this is going to be hyperpigmentation, advanced photo aging, telangiectasia, keratosis, and typically ages 40 to 50.
Same age? Oh,
40 to
Sorry,
50.
you answered that. I'm sorry.
And Glygal type 4 is going to be predominant wrinkles, severe photo damage, severe scarring may be noticeable, and ages are not specific. So type 4 can happen to anyone at any age. All of them can happen to anyone at any age. It just depends on how much sun damage is causing the wrinkles on the skin. So I have sun damage, but it's not causing wrinkles, it's causing pigmentation. That's the difference. So Glygal 1, even though I have an excess level of pigmentation. Don't worry, we will talk about pigmentation. This is a lot for this lesson, so don't worry. I'm trying to get through the details and then go from there. So the Rubin's classification, I'm going to read directly from the book. This uses levels to classify photo damage, sun damage, by the depth of skin changes or damage. This indicates what type of treatment is appropriate for the skin condition. Level 1 includes superficial pigment and changes in the epidermis. Level 2, changes in the epidermis and papillary dermis.
Oh.
Level 3, deeper changes down to the reticular dermis. Skin looks leathery and shows severe sun damage. This is the next level from Gligal,
Yeah.
but it factors in pigmentation at this point. That's all the changes. It's taking, instead of identifying wrinkles, it's identifying all sun damage. So for me, I'm a Gligal 1 because I have very few wrinkles, but I'm probably a level 2 on the Rubens classification because I have advanced pigmentation that more than likely goes down to the dermis. The way you check that is with a Woods lamp. I'm gonna go get it so you can see it.
Oh yeah, I can't. I was like trying in 3 different positions and finally I was like, I can't. I'm not gonna be rubbernecking this whole time. What is it?
This is a Woods lamp. It uses black light to see underneath the skin.
Ooh. That's like a brutally honest lamp.
It is. Hey Jessica, can you do me a favor and turn off the light? Can you close the curtain?
So you said that machine sees sun damage?
No. Jessica, you turn the light off.
And mine's bad. And yours is not.
Oh yes, it is.
We're too far
I see
away.
nothing on it.
Come
I'm
on.
gonna come and peek. Yeah, I see.
Do you see colors? Yellows,
Yes.
whites,
Oh,
orange. Look at my
yes.
lips. I bet they're white.
Mm-hmm.
That's
Hold it
dead
a little
skin.
bit higher.